Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, happy Monday. Today's episode is going to be all about fillers, and we've been misinformed. I feel like fillers need to get their swagger back. Everybody is hating on fillers. They're talking about complications and fillers gone wrong, looking like a filler face. It's very anti-filler culture right now. And really, the filler is not the problem. It's the person behind the filler, the injector. It's also the person in general getting the filler, you guys. When we are assessing patients for filler, it's important that we determine three things. Number one, right injector. You need to make sure that your injector is well-trained, is an expert in this area. There are many injectors out there that don't know how these fillers work. They don't understand what these fillers are made of. They don't understand the filler's personality. So they're using one type of filler all over the face, and that's a huge miss. The other issue is right candidate. And just because somebody comes into my office and wants filler in a certain area, I will tell them no. I say no all the time. If you are not a good candidate for filler, I'm not giving you the filler that you want just because you want it. So you need to make sure that you find an injector that's not afraid to tell you no, and that will tell you what you are actually a candidate for. You may be the wrong candidate for filler. And then the other issue is right product. And we need to make sure that we have the right product being injected. Filler is not a one-size-fits-all. So, for example, there are fillers that attract a lot of water, and those fillers can be really great in areas like the lips maybe, but they're not going to be very great in the smile lines. It's going to make you look puffy like a bulldog. So, understanding how these fillers work are very, very important. So, right patient, right injector, right product. These three things, you will have amazing filler results. And there's some things that people are more misinformed about. Not only that filler is bad, but people think that filler lifts. Filler doesn't lift, okay? I have to tell you guys, filler does not lift. If you are getting filler thinking it's gonna lift your face, you are wrong. Filler volumizes. And what that means is it adds volume. So if you are looking to lift your face, if you go into my office or any injector's office and you're like, I want my face to look like this with filler, filler's not going to do that. You're going to need filler. You're probably going to need a facelift. Maybe you need some threads, lasers, biostimulators. We're going to need to throw the kitchen sink at that. We're not just going to use fillers alone because they don't lift. When placed strategically, it can look amazing. For example, we lose volume in our temples. Temple hollowing is like one of the number one aging indicators, and it's super prominent right now, especially because prior to this year, we didn't have an FDA indication for filler in the temple. And what that means is fillers were being used in the temples, okay? Just because it's not FDA approved in a certain area doesn't mean it can't be used. What that means is it's just not FDA approved in that area, but it's FDA approved somewhere on the face so we can use it. For example, Dysport is only FDA approved in the frown lines and the crow's feet. We put it everywhere. We put it on the forehead, put it in the frown lines, we put it in the neck. So just because it's not FDA approved in a certain area doesn't mean you can't use it in different areas. However, what happens is when something doesn't have an FDA indication, people lack training on it. So people aren't doing temple filler because they're not trained on it. They don't know how. So what are people trained on? Cheeks. And what's happening is all of these new injectors are injecting cheeks, and they're injecting lateral cheek in particular, and people are getting wide looking. They're looking unnatural because they're getting hollow in one area, wide and volumized in another area because they think filler lifts. It doesn't. So that's a big miss. Now that we have an FDA approval for temple filler, I think this is going to change. And this is actually something I talked about in a previous episode about ranking summer treatments that RealSelf talked about. RealSelf actually said temple filler is trending, and that's huge. And it's because it has an FDA indication. So more injectors are being trained on this area. Therefore, they are treating this area, which is a game changer because when we lose volume, we look old. So when we revolumize, it will give a lifted look because we've lost volume and we're adding volume with filler. So temple filler actually does make you look more lifted. It just doesn't lift, it adds volume. So that's a very important area that we need to be assessing for and treating, especially when it comes to volumizing the face, because when we volumize the right areas, you will look more lifted. It's freaking amazing, right? It's like a math equation. I always explain this to my patients, but in math, it's like you either love it or you don't love it. But if you are to take away volume in one area, add volume in another, it's going to look weird and disproportionate. You have to make sure you're injecting proportionately, which brings me to my next point. Filler, when placed appropriately, looks freaking bomb. So what do I mean by that when placed appropriately? We have to make sure not only are we assessing our patients to determine where they need filler, but we also have to make sure we're placing filler in the right depths. So this is another big myth that people say all the time on social media. Filler migrates. No, filler does not migrate. It doesn't have little legs. It's not running away. What happens is filler can be displaced, and particularly it can be displaced when it is not placed in the right plane. So let's look at the lips, for example, because people get lip filler migration all the time. You can go to a very trained expert injector and still have an issue with filler displacement. That just happens. It can happen no matter what. If you've been getting filler long enough, you may need to dissolve and start over. However, choosing the right injector that picks the right product and is injecting you in the right plane is very important because your filler shouldn't always migrate. If it's always migrating or being displaced, that means it's being placed inappropriately. So in the lips, for example, we have to be very, very careful to place filler underneath the vermilion border. We also have to be very, very careful to place filler superficially above the muscle. So what happens is muscles move. We smile, we laugh, we talk. So if we place filler in the muscle, it's going to get displaced because of muscle movement. So that muscle is going to push the filler out of place. That's what happens. It's displacement due to muscle activity. So it's very important that you go to a trained injector that can place your filler appropriately. You shouldn't have filler migration issues, filler displacement issues, really anywhere in the face if you're getting injected in the right plane, unless it's in the lips. That's like the one variable area. And that's just because over time, smiling, laughing, and talking, when you get filler enough, you may have to dissolve and start over. But I've never had to dissolve filler in my cheeks, in my temples, in my chin. I've only had to dissolve my lips once, and that's because of pregnancy, which I'm pregnant right now, so I'm sure I'm going to have to dissolve and start over again because they look swollen and crazy. But that's really it. And it's because I've been injected in the right plane. And I've been getting filler, you guys, forever. So I've been doing filler since I was 25. I'm 33. So I've been getting it for years. And my filler looks natural. Now, some of you might be like, no, Kristen, your filler looks weird right now. I'm pregnant right now, so don't judge my face right now. Wait till you see me after baby. But filler looks really natural and you won't have to dissolve it when you place it in the right plane in every area except the lips. That's the only issue. The other filler myth or misinformation that you guys were told is that filler dissolves quickly. Now, we are looking at these like viral MRI scans on social media and we're seeing filler. We're like, oh my God, there's filler that's been there for 10 years. That's not a bad thing, okay? That's a good thing. This person on the viral MRI, they actually looked amazing in real life. So it doesn't matter what the scan shows. Yes, the filler is going to be there. What matters is what the patient looks like. And this patient looked freaking awesome. So it's not a bad thing that fillers last a long time. It's a good thing. As long as you're right patient, right product, right injector, it's a great thing. I like to use the analogy like a cavity filling. Who wants to get their cavities filled once every month? Raise your hand. No, you do not. That freaking hurts. That's miserable. Now, who wants to get their fillings done once every 5-10 years? Me. Sign me up. And that's because I don't want to go through that all of the time. So there's something with filler and it's called the compounding effect. So I'm going to explain this to you guys. When you go in to get your filler and you get 4 or 5 syringes, which is average for facial balancing in one session, and you come back 6 months later for a refresh. So you come back 6 months, you see what everything looks like. Maybe you get another 2-3 syringes at that time to make sure you're appropriately balanced. This is what I do for all my patients. And then after that, 1 year later, you may get 2 syringes, okay? And that's because there's something called the compounding effect, meaning when we layer filler, it lasts longer. So the more filler that you layer, the longer that it lasts. Now, what's important about this is because you don't need to be getting your cheeks done every 2 months. If you're getting filler every couple months on your lips or your cheeks, you're going to look freaking weird and unnatural because of that compounding effect. That filler is going to last. That's why people will end up looking like duck lips, is because they get too much filler. So it's important that we have a really healthy amount of filler being injected because these fillers last a long time, and it's a good thing. You want it to last a long time. I don't want to get filler done every month. I want to be able to go a long time without getting injected. Like right now, you guys, I did filler in November. I did 4 syringes of filler, and I'm not going to need filler for a while. After baby, I'm going to get skin tightening treatments. I'm going to do my Sculptra. I probably won't do filler until like mid 2026. So it's going to be like a year and a half. And that's because of that compounding effect. I've been getting filler for years, so I need it less often and I need less. So you need to find an injector that will see you for annual filler maintenance, but they're not just injecting filler to inject filler. They're assessing you and they're monitoring your symptoms. So if you have volume loss, we add filler. If you don't, we don't. And we use combination of biostimulators like Sculptra, Hyperdaily Radiesse to thicken the skin, improve the skin. We're doing in-office laser treatments. We're doing microneedling, chemical peels, all of these things to keep you young without relying on filler alone. So that's super important to understand. Another thing is facial balancing. And what I mean by facial balancing is we are not injecting a single area. And people need to understand that they don't necessarily know what they need. I see patients all the time that come in and they're like, Kristen, please, I need my lips done. And my lips feel smaller. I need them done. And I will look at that patient and truly assess if they need their lips done. And what I mean by that is that some people think they need their lips done because they see themselves 2-dimensionally. When you look in a mirror, 2-dimensionally, right in front of your face, that's all you can see. As aesthetic medicine providers, it is our job to assess you from a 3-dimensional standpoint. So we are going to see things that you don't see. And when somebody comes in and they want their lips done, they may actually just have lost volume above the lip. They may have lost volume below the lip and actually only need filler in the deep piriform space or filler in the plain subcutaneous area right above the lip or filler in the chin. You don't actually need lip filler. So facial balancing is strategically adding filler in areas that will harmonize the face. We cannot be afraid to say no as aesthetic medicine providers. We need to guide our patients and tell them where they need to be filled in order to achieve their desired outcome. And sometimes that means saying no. So that's super important. So how do we balance? Well, what I do is I divide the face into thirds. So I'm going to assess the upper third, and that's going to consist of temple hollowing. So I may recommend temple filler or Sculptra in that area. It's going to consist of assessing for volume loss and wrinkles in your forehead. So some people lose volume in their forehead. They may be a candidate for filler in the forehead to revolumize that area. You may have fine lines, wrinkles, be a better candidate for Botox in this area. The next area that we assess is the mid-face. And so we are not injecting just lateral cheeks. I literally never inject a lateral cheek, especially on females, because it widens the face. And what's actually happening as we age is we're losing deep and superficial fat, and then our fat pads are falling. So we feel like we have fat cheeks, but really we've just lost that deep volume that needs to be replaced, and you will get a lifted appearance. So the filler isn't actually lifting, but you will look more lifted by adding volume in the right areas. So typically I'm injecting in the medial deep cheek fat pad, medial SOOF, lateral SOOF. These are areas of the face that I'm constantly assessing. Part of this mid-face assessment too is the under eye. And are you a candidate for growth factors underneath the eyes to add restoration and balance? Then we move to the lower third, and that's where I'm assessing smile lines. I am assessing volume loss in the chin and the jawline. So I'm really breaking the face down, assessing each area strategically and determining where you've lost volume and where I can put it back to give you a lifted appearance, not actually lift your face, because filler doesn't lift. Now, facial balancing is not just about volumizing areas that lack volume. It's also about harmonizing features. So we need to use a combination of biostimulators like Radius and Sculptra. We need to use lasers for resurfacing. All of these things are going to be combined with filler to give you a very natural result. So very important with fillers, right patient, right injector, right product. So I want to wrap up this episode doing a little rapid fire of my favorite areas to get filler, because I think this is super important and everybody here will hopefully want to know this. Number one, temples. Temples are a huge sign of aging. So if you have not had your temples filled, you need to assess to see if you are a candidate. Go to an experienced injector so they can assess you. Most people are. However, it's important to understand we don't want to over volumize this area. As females, we want a slightly concave appearance, meaning a slight dip. We don't want a big dip. We want a slight dip. So we don't want to masculinize the face as females by giving too much correction here. So important, go to an experienced injector that can assess you for this area. The next area that I love to get filler is the chin. Chins change lives, you guys. I'm not joking. Chin filler is a freaking game changer. It will accentuate your profile. It adds volume where volume's been lost. It literally makes the face look 10 years younger. Love filler in this area. Another area that I actually really love to fill also is going to be the medial cheek. Now, it's important that we do minimal amounts here. We used to do like tons of filler and people looked like they had apple cheeks. That is out. We do not want that. We want teeny micro boluses. Little bit here, little bit here, little bit here, sandwiched with filler superficially in order to give this really pretty OG cheek pop that looks very natural, not overdone, very subtly done. Those are probably my top 3 areas that I recommend getting injected with filler. I personally love like Sculptra or Hyperdilute Radius in the preauricular space. I love that for smile lines. I don't really love traditional fillers in these areas. So that's just me. I think less is more. So find an injector that will talk to you about what you are a candidate for, that relies on the less is more method, and will assess you appropriately. Thanks for tuning in to today's episode. I will see you guys next week.